Hello, my name is Kate Knowles. I'm the Nottingham and Nottinghamshire ICS ACP project lead. Workforce and transformation programmes in the Nottingham and Nottinghamshire ICS have resulted in a promotion of ACPs and involve many organisations and individuals. The implementation of these roles without a standardised ICS ACP governance structure has produced a variety of roles, definitions, training programmes, role development and governance. The ICS ACP steering group consists of ACP leads and key stakeholders across the city and the county. They identified that the ICS advanced clinical practice needs to be standardised urgently. The ICS secured HGE funding and in spring 2021 recruited into the two roles of the ICS ACP project lead and the ICS ACP primary care lead. The roles were hosted by the Nottinghamshire Alliance Training Hub, known as NAF. KPIs were identified and lines of responsibility were established. In terms of the KPIs and milestones for the two roles, we found that the most important priority was find out exactly who's out there working in the ACP role, both in the role and in the level of practice. And we were going to do this through a scoping project that we'll describe in a moment, but the other way was actually speaking to the organisational leads. We took the opportunity not just to scope who was out there in terms of roles and levels of ACPs, but also find out what the ACP priorities and requirements were. These were our first two KPIs and milestones.
Hello, my name is Ruby Legbeja and I am an ACP primary care lead for the Nottingham and Nottinghamshire ICS. So the first phase of our project started with the Health Education England scoping that was done in April 2021. This survey, we had 32 respondents. Kate and myself work with universities with the Nottingham and Nottinghamshire area, and we have established network within the educational sector as well as within the organizational sector. And it's come to our awareness that the HE survey does not truly reflect the number of ACPs within the ICS. It's also come to our awareness that 1/3 of the respondents to the HE survey were not practicing at an advanced level. A more robust data collection was needed for us to proceed. So we used a 3-step strategy to enable us gather information that could be that is reliable. And we started by engaging stakeholders. We had one-on-one meetings with ACP leads within the ICS, and we raised awareness of the current situation of ACP roles, and we gained their agreement and support for the project. The second stage was to create an Excel sheet where we could populate or put in relevant information on ACPs that we came into contact with. We used a three validation process, 3 steps to validate our data. So we started by using ACP leads within the ICS to collect the information that we needed. Within primary care, where ACP leads were not identified, was where we had a lot of problems, and we had to start this data collection by sending surveys to practice managers, practitioners themselves, for them to fill out and send back to us. The second validation stage was we going to the website of all the GP practices and checking their staff information, and example is where it's mentioned like know your team. This is where most information about the non-medical practitioners are being displayed. A triple validation stage that we did, we made phone calls, we followed up with emails, and also team meetings with practitioners to validate information. So as it stands, the information that we have at hand, it's more reliable.
Hello, my name's Adam Jones. I'm an Operations and Liaison Manager. I'm part of the ACP project, and I help bring together the data that we're gathering in order to look at the impact we're having on the system. So the information that we gathered clearly shows that the ACP numbers in our area are higher than we initially thought, with the highest numbers of ACPs in secondary care, slightly less within primary care, and then about 60 odd in community care. Unfortunately, there's nobody in social care at the moment. Other information shows the professional background of ACPs. So this was overwhelmingly from a nurse background, which wasn't surprising. And we had about 320 ACPs that identified as being from a nurse background. The next figure would have been for physios, around the 20 mark, and then paramedics. So whilst those are growing, it's still overwhelmingly a nurse-centric background at the moment. Job titles within ACP, as we've mentioned, some people don't identify currently as a ACP, and we're trying to change that going forward. And then we're seeing that there are a lot of individual job titles with only one or two people, and we're hoping to get these to move towards more of a uniform job title. So this information has been really important in helping us understand the ACP population, and the trend we're noticing is that where an ACP lead exists within the system or within an organisation, we're able to get much better data because that person then is able to offer an overview of the ACP workforce and better understand what the role it is and what it involves, and identify individuals that are not currently identified. So we currently have 3 within organisations across Nottingham, and then the 2 that lead this project and obviously work for the ICS. So in areas where we didn't have an ACP lead, it was found that the role was generally less understood. To compensate for this, we created an infographic and circulated it to help bring up general awareness and the level of understanding around the role.
I'm just going to share with you now some of the specific findings from primary care scoping of advanced clinical practice. We were able to pull up 82 validated respondents as working at an advanced level. On our analysis, we had 3 practitioners who had a full MSc qualification in advanced clinical practice, and 2 of these are nurses. One of them is a paramedic and is the only one who maintains the title advanced clinical practitioner. Allied health professionals in advanced clinical practice were found to work mainly across the PCNs and also across the federation. They were not directly employed by the GP practices.
And so, in conclusion, in order to promote the safety for our patients, our individual clinicians and our employers of those clinicians across the ICS, we need to standardise advanced clinical practice across the system with a more robust governance and career structure. ICP lead posts enables more time to be dedicated to focus on this work. Scoping data that we have shown you today shows that we still have wide variations, but we'd certainly have greater clarity on certain aspects of ACP data where we have organisational lead posts in place. Although incomplete, some data shows great investments in where organisations have started to increase their numbers of ACPs, and also in recruiting allied health professionals and pharmacists into ACP roles. And so going forward, this data will continue to be updated and enlarged into greater fields of data, enabling us to better understand areas such as the training needs, both for trainees and for qualified ACPs, and areas such as supervisor assessor status. We will continue to build networks, this is imperative, to facilitate the communication and improve the understanding of advanced clinical practice. And this, supported by the national work from the Centre for Advancing Practice, will enable us to promote the descriptors for enhanced and advanced clinical practice, and therefore identify those working at levels of advanced clinical practice.
Thank you for taking the time to watch our presentation.
We welcome your feedback through the Nottinghamshire Alliance Training Hub.
And over the next year, we've got more work that we're going to be doing, and we look forward to working with you all. Please keep in contact with us, and we look forward to talking more in the future. Cheers. Bye.
Bye.
Bye.